Hampton is a county seat town, between 4,000 and 5,000 people. The practice that my wife and I have currently is a 3-doctor mixed animal practice. We do 40% food animal roughly, 40% small animal, and about 20% equine. If it can make it through the door or be carried through the door, we usually see it. We're headed about 10 or 12 miles north here to just outside a small town of Thornton to address a hoof abscess on a horse.
Good weather this live.
No, in any case, we'll be on the way.
Okay.
Thank you, Jim.
Yep.
Being in such a rural area, distance from clients is definitely a concern. In a large sense, what the VMLRP allowed my wife and I to do much more rapidly than we ever would have otherwise was actually to buy the vet clinic that I work at. If I wasn't here, people would have had to travel even further to get their medicine and to have their animals treated. And so I really believe that we do provide a very important service in an area that is strongly needed. If you're really looking to prolong and or ensure the future of large animal veterinarians or veterinarians in rural communities, the VMLRP is very important, I believe, because when you graduate from vet school with a large amount of student debt and you end up having to find a way to pay that student debt relatively quickly and enter professional life, buy a house, get married, have kids, whatever you're going to do in the rest of your life, it poses a pretty darn big challenge. And that VMLRP, if it can help those new young students or those new young veterinarians do what they love, like work in a mixed animal or rural practice, and yet still be able to enjoy, a decent quality of life, decent living, and be able to provide for a young family and stay in the communities the rural communities where you want them. That's the whole goal of the program. Without it, you're fighting an uphill battle to keep rural veterinarians where they're at. And yes, I will continue to stay here. We have family here, we have roots here. My wife teaches in the local school district, my kids go to school here, and we've invested in the business. We'll be here. We've put roots down.
Dr. Vosburg is just one of the 285 veterinarians who have been serving in 45 states since 2010 through the VMLRP. Learn more about this program at avma.org/helpruralamerica.